We're going to move to our 6.5 item, our 10 a.m. item, consideration of an update on COVID-19. So I know Dr. Pace is on there. Dr. Pace, are you? There you go. Welcome, Dr. Pace.
Thank you. Good morning, Mr. Chair, the supervisors, and to the public. Thank you for having me here again today. We're going to talk about the COVID outbreak and the response today. I think kind of what I wanted to do first was just sort of state what probably everybody's aware of is we're having a big rise in cases locally and also around the state and around the country. It's getting kind of concerning in terms of hospital availability, and it's a particularly worrisome time, and I think this is going to go on for another month or so, and so I just really want people to be kind of seeing all this through the lens of real caution, of moving into a difficult phase here, and how we can best move through that, how we can keep the businesses afloat, how we can keep people's mental health in a good place, and how we can keep people safe from the virus. And so first off, Sarah, the epidemiologist, could not be here today, but we have a short video of her talking about the current data. This is from yesterday, so there's a little bit, was from yesterday. It's a little bit worse today. So just read it, kind of listen to this and hear that in the same way. Then I'll come back and talk. And then we also have Dr. Sharon, who's working with us now, who's going to talk a little bit about the vaccine at some point. So, but let's go ahead and go to the video, Jake. Thank you.
Just going to share a couple slides to update you on the latest at the state and regional level and here in Lake County. First, we're going to start in California. So these are data reported today, which represent yesterday. So as of yesterday, the state has nearly 1.6 million COVID cases. This dark blue line is our 14-day average, so it continues to increase dramatically since it has in early November. Of note, 14 days ago when I reported these data, the state had nearly 1.2 million cases. So we've seen 400,000 new cases in the state in the last 14 days. And then hospitalizations lag about 2 weeks after new infections. So here we see this steep 14-day average line of COVID hospitalized patients in the state really start to take off in mid-November and continues to increase dramatically and will until we start to see this line start to bend down. So at the state level, nearly 15,000 COVID hospitalized patients a day. And over the last couple days, we see about 500 or so on average new hospitalized patients due to COVID. I wanted to share the projections at the state level. So this is daily hospitalizations using data from December 12th, about 13,000 COVID hospitalized patients. That's this black line here. And then here are the different projections from different models. And this blue line is all the projections sort of brought together, and it's been tracking pretty well for various metrics recently. And so projecting about 29,000 or 30,000 COVID hospitalizations by January 13th, and on Christmas Day, projecting about 19,000 hospitalizations, so about 6,000 more people in hospitable beds by Christmas. And again, just, you know, there's not much we can do about this number, this Christmas Day projection at this point in terms, these are people who are likely already infected or will be infected in the next couple days. So like Dr. Pace said, everyone's really paying close attention to ICU beds and the number we have available regionally and throughout the state. So we have about 1,400 ICU beds in the state, continues to decline, and we'll continue to see that decline again as that case rate continues to go up. And a couple days ago at the state level, sadly, we had a new high of 225 deaths in a single day in California due to COVID, and this 14-day average, again, will continue to follow our new case average. Here's the projections of ICU capacity at a state level. So on December 12th, about 3,000 ICU patients, projected to about 6,600 on January 13th, and on Christmas Day, about 4,300. And this is about 1,400 more ICU patients, which again is about the remaining capacity at the state level in terms of the number of beds. So if you go here, we have about 1,400 remaining, and by Christmas, we're expecting about 1,400 more people needing ICU care. So here we're looking just at the total of tests being conducted in California. So our testing has increased rapidly over the Thanksgiving holiday. Sorry about that. And also our 14-day average, our testing positivity has increased with this. So this is an indicator to me about how widespread it is in our state and in Lake County, because similar trend in Lake County, we had about 2% positivity a couple months ago, and now we have about an 11% positivity. So that's in part, I think, due to the targeted testing, but also because it's widespread in our community. So let's look at some Lake County data here. The green line is Lake County. We're looking at the daily case rate per 100,000. So for the week ending December 5th, this is sort of the week after Thanksgiving, Lake had a daily case rate of 26 per 100,000. Compared to about the 6% or the 6 per 100,000 it had in early October. We see the California rate at 64, more than twice the Lake County rate. And then the Rancho rate is in orange at 41 per 100,000. And then here's the testing positivity in Lake. I mentioned up to about 11.5% for that week after Thanksgiving. And this is unusual for Lake. Usually we're below the state and the region in terms of testing positivity. I think this is, again, as a result of some outbreaks and targeted testing, but also an indicator of how widespread the virus is in the community. So as of this morning, Lake County has had 1,306 cases since the pandemic began, just 284 cases in the last 10 days, which is a 28% increase. Nearly 200 active cases. Again, our numbers have never been this high, generally reporting under 100 active cases. Really until these last 3 weeks, where nearly 400 new cases came in the last 3 weeks. Which is almost 30% of our total to date. So nearly 1,100 people have recovered. There have been 22 deaths and 12 are currently hospitalized. And what I want to point out here, because I think it's important for thinking about people getting really sick over the next couple weeks, is this this bar right here, which shows 132 new cases or new infections the week of Thanksgiving. These are the folks who are, 2 weeks later are hospitalized, and some may need ICU care. And so this bar in purple, which will make up our tier assignment that the state will release tomorrow, will remain in the purple tier with widespread transmission. But this group of people are starting, those that will become hospitalized will be hospitalized this week, and some will need ICU care. Those became infected last week. Those who need, a higher level of care will show up in our hospitals that week leading up to Christmas. And then, those who become infected this week will really need that critical care the week after Christmas leading up to New Year's Eve. And I expect that we'll see an increase in the number of cases for this week of December 6th because data are still coming in. So it's these three cohorts, if you will, that we're really concerned about thinking about the care that they'll need over the coming weeks. And just back to a regional level, we're looking at the adult ICU patients since early October, the percent that are COVID positive. So the purple line here is San Joaquin. You can see about 15% of their ICU patients were, that's about 15% were COVID positive in the beginning of October, and it's and now half of their ICU patients are COVID positive. The Rancho region is in red, just under 30%. And then Lake, you can see, because our smaller number of ICU beds, pretty wide daily fluctuations, but most recently just above 30%. And then this is the big indicator that we're all tracking. So as of today, the remaining ICU capacity in the state was 6.5%, down from 9% just a couple of days ago. And Rancho, 29% remaining capacity. And we have a total, it fluctuates a little bit on a daily basis, but about 120 non-surge ICU beds in the region. And then the Bay Area is at about 18% remaining ICU capacity, with Greater Sacramento, Southern California, and San Joaquin under the 15% threshold. And then here, as of today, all but 4 of the counties are in the purple tier, or the widespread tier. I don't see this changing anytime soon. So that's all I have to share. Thank you very much.
Thank you, Sarah.
Okay. So, yeah, thank you. So, again, that was from yesterday, and today the numbers are a little bit worse. Just to clarify for folks that weren't tracking that, the Rancho is the Northern California region that we are considered part of in the way the state is trying to determine this whole capacity. They're trying to work within regions, and Rancho starts, Lake County and Mendocino County are the 2 most southern counties, and then it moves all the way up to the Oregon border. So Northern California or Rancho, they're kind of using interchangeably. So I think a couple of the key points is, one is that the cases continue to rise without any sign of slowing down. And then a week or 2 later, the hospitalizations seem to be rising as predicted. And then a week or 2 after that, the death rate seems to rise as predicted. If you follow those graphs forward, the state will have the same number of people in the ICUs as there are total ICU beds. So that by Christmas or so, it looks like if things go as they're going, there will be no more ICU beds in the state. I did speak last night with the kind of one of the dispatch people who works over the whole state, and she said right now that there are very few beds around the state where they will accept COVID positive patients. So she's in a situation where they have something like 50 people down in Imperial County, down at the border, who cannot get placed anyplace else. Before, back in July, they got transferred out to other places, but now nobody's accepting cases. And so they're in a tent in a parking lot out there now. And these are people that need hospital care. So it's a very concerning situation. And I think it's just important that the board and the leadership and the public understand what's lying in front of us here. So in Lake County now, we have 1,335 total cases since the beginning, 174 are active, 22 people have passed away. The number of cases is up dramatically, as you could see on the graph there. The hospitalizations, we have 10 people in the hospital now, 3 of them are in the ICU, and at this point, 7 of them are local, 3 are out of the county. This is about the same number of folks we had in the hospital as last week, although it's more in county than we've had previously for COVID positive patients. I think that's because we're starting to see the impact of the pressures on the other hospitals. I know in Sonoma County, they are having trouble having access to beds. In Napa County, with St. Helena open back up now, we have a little more access. I also know that down in the Central Valley, where they're basically out of beds, they're backing up there. Adventist is sending some of their patients up to Mendocino County now because they have a pretty good sized hospital in Ukiah. And so they're actually decompressing some of their hospitals in the Central Valley now by using Mendocino County. So, we're in a situation that is kind of a scramble now, and by all indications, it's going to get worse. So the total positivity rate, the test positivity rate, as Sarah mentioned, was 11.5%. The case rate, we talked about all that. So the part of what's happening around the county is where before we were seeing kind of specific outbreaks or places where we could identify what was going on and try to contain it. It's now just kind of everywhere. There's a big outbreak in one of the tribal communities that's something like 80 plus total cases now. So a lot of those people are now off isolation, and it seems like some of that work may have contained it because we're not seeing a whole lot more cases right now. We're doing another round of testing tomorrow. But that's been a concerning scenario. A couple of the nursing homes have small little clusters in them. There's not a big outbreak right now in any of the nursing homes. Several of the schools are seeing clusters around there. Several businesses around the community are seeing clusters. And basically through all the zip codes, through all around the county, there's just a lot of different cases. Partly what's happening is for our response, we're going to have to change our whole approach. People are not wanting to talk to us. They're not really answering the phones. They're resisting us. There's a lot of angry responses when people are trying to do contact tracing and everything. And we simply don't have the people to keep up with it now. So we're actually in a position where we're going to pivot. We are, because the vaccine's coming in, and we'll talk about the vaccine in a little bit. And we've been trying to encourage people to do proper behavior and to stay home if they're positive, or to not go to work but we have businesses that are basically reportedly telling people not to let anybody know they're positive. We have people that are, going out even though they know they're positive, even though they know they're not supposed to, on and on. So we are now in the position of trying to shift to basically do the basics with the case investigation and contact tracing, make sure that people know they're positive, give them written information, and if they want to do it, they can do it. And if they don't want to do it, then we're not going to track them down anymore. And then to make sure the data is good, so it's going into the state in a decent way. So we're kind of trying to prioritize that piece and then shift some of our staff to working on the vaccine response, because that seems like we're probably going to have better luck with that. It's kind of sad because up until this point, I think partly why we've done so well in Lake is certainly the people doing what they can to not spread it. But I think part of what's happened is because of the way the nurses have been working and being very hands-on and trying to engage with with folks that are testing positive or that are at risk, and trying to support them in containing it has been helpful, but it seems to be falling apart at this point. And so we're going to pivot to working on and focusing on the vaccine. So let me just kind of go through some of the specific details about things just so that people are aware. The testing is going to continue. The state contract is switching from Verily to a different testing company called OptumServe, which is one that's basically going to be doing the whole state. So it looks like the switch date is going to be December 28th, although we're not positive about that. They're still kind of a little wishy-washy about it. But you will notice a different strategy towards getting an appointment and things like that, starting from that new time. Over the Christmas holidays, so starting next week, the county offices are closed next week, but we will continue the testing on Monday and Tuesday in Clear Lake, on Wednesday in Lakeport next week, and the same the following week, New Year's week. Also, we are going to be shifting some of the sites. So we've been working at going to 4 sites around the county, but the 2 of the less frequent sites, we weren't getting the numbers we needed. And so with the new contract, they're not wanting to continue with those. So we're going to eliminate the Middletown site and the Upper Lake site after tomorrow. So Upper Lake will be on tomorrow, but after tomorrow, there won't be any further Upper Lake sites. Both of those sites, we're really sorry about that. We're proud of going out to all around the county like that. It was a good thing. And now we're not able to do that. If we get an outbreak in one of those settings, we're going to try to do what we can to put a stand-up testing site out there, which is what we've been able to do so far in some of the other places. So I can't promise that, but that's our intent. And we're not interested in, withdrawing support. We're trying to expand support, but we're needing to kind of focus our resources a little bit. The contact tracing, as I said, is really shifting. They will get their notification, and there's an online survey they can do to give some of the information in, which will be one of the ways of helping to do that. And we're going to be giving people information or links to how to isolate and quarantine. If there's questions or concerns, they can contact the Mohawk line. The other thing is the Mohawk line is still open Mondays through Fridays, 8 to 5. The next 2 weeks, it'll be Mondays through Wednesdays because of the holidays, but we are planning to continue that indefinitely. There's also this California Notify app that you can get on your phone that also does some contact tracing notifications. You can go online and find out about that if you're interested. The housing situation is basically unchanged at this point. So to talk about the surge cases, this is part of what I've been kind of laying out the data for, but this is, we are concerned about what we're seeing and what may be coming in the coming weeks. We're meeting weekly with the hospital partners and with the EMS, and the local hospitals do have some capacity to increase surge, but I don't think it's going to be the answer to all of the questions with this. And our model here has always been to transfer people out, but if all the places you transfer people out to are full, what are you going to do then? The state is trying to stand up 80 more ICU beds in Northern California, 20 in Chico, 20 in Marysville, 20 in Redding, 20 in Shasta, and they're also trying to support other people to do it. These are actual ICU beds. They're not up yet, and are they going to be able to find the staff? I don't know. They're scrambling as fast as they can to try to do this. Again, other counties are in worse shape than us, but we are probably not too far down the line from that. The other thing is the sleep train pavilion in Sacramento now is open for 10 beds. They're having trouble getting enough staff, but they say they're going to be able to open as much as 200 beds there as a step-down unit from the hospital so that we can decompress some of the hospitals. There's also some plans in place. So, just to let you know what my days are like, we're trying to meet with different partners around the community about how to set up transportation. So if we have to move 10 people down to the sleep train, we don't have 10 ambulances to do that. So we're trying to set up some through the transportation partners in the community to see if we can get something going with that. If the ERs are getting filled up with people that are COVID positive, is there a way to redirect some of these patients that have to go, that need to get care, but they would typically go to the ER, but that they could go to some of the clinics. So we're trying to set up these sort of models of how to do care differently from the way it's always been done because of the concerns about what we see coming. People like to talk about enforcement. They have a lot of questions about enforcement. Craig came in last time and spoke a little bit about the way we're doing it. The compliance officer jobs have been posted now, so we'll see if we get some interest in that and see what we can do with that. They're going to need to get trained, so it's going to be a little bit of a while. And again, this is so widespread at this point that having 2 part-time compliance officers is probably not really going to change things very much. People are pretty much at the point where they're going to do what they're going to do, and we're going to be rolling with the consequences of that, I think, at this point. We really encourage people to keep taking the safety precautions that we've been talking about all along, and if there's any question about that, we can connect you in. So the disparity issues that we talk about sometimes, the 2 RFPs for services and outreach and communication with the Latino community and with the Native American community. Today is the last day of the to apply for those positions, and we're trying to get some community partners to help us reach these communities that have been the hardest hit. The statistics are changing a little bit. The Latino community was at about 50% of the cases, and now it's down to about 35%. The Native American community is rising a bit because of this big outbreak, I think. But, again, it's these are typically communities that are reluctant to engage with the medical system and with some of the typical services. And so we're really trying to develop some other services to reach out there. So then the vaccine is started. It's in California right now. And maybe, so Molly, if you can get on here, Dr. Sharon is going to give a little update about this, and then I'll come back and finish up, and then we can answer any questions at the end. So go ahead, Molly.
There you go, Molly.
Good morning. Thank you so much for allowing me to be here today, and thank you, Dr. Pace, and thank you, Chair and Supervisors. I would like to just go over briefly what we know about the vaccine and what we're working on specifically for the community. As many persons know, the vaccine was approved, the Pfizer vaccine for COVID-19 was approved over the weekend, and there were numerous meetings to go over the technical details and safety and efficacy of this vaccine. Those meetings were so well attended that some of them actually had to be recorded to be shown at a later time because the events were capped out at 20,000 healthcare professionals from all over the country. So it's a very, very big moment here. What I think is really important to recognize is how protective the vaccine is, as well as how hearteningly safe the vaccine is. We will be receiving 975 doses later this week, and those will be distributed to healthcare workers first through a very specific tier plan in order to protect the community. Those 975 doses are paired with the second one, so we do not need to only give half of them now. So we will be able to immunize 975 people with this first round in 2 series. We're coordinating with our local hospitals as well as EMS. And I would like to then talk a little bit about how very impressed I am by the safety data I have seen for this vaccine. I think it's really great to know that mRNA treatments, like this vaccine specifically, are used elsewhere in medicine. And I think that's very heartening. And one of the roles that Dr. Pace and I have is sort of, it's our job to worry so that the rest of the community doesn't have to about these safety concerns. So I really poured over the data about who's most vulnerable to have a problem with the vaccine because of an immune system issue or something like that. And I am so heartened and impressed by how safe the vaccine is for the persons it's approved for, and exactly what that means for the entire community and how safe the vaccine is. The faster we can get everyone who is eligible immunized, the better our businesses will do, the better our families will do, and the better chance that each person who we want to spend the holidays with, who we may not be able to spend the holidays with this year, will be alive to spend the holidays with us all together next year. I am really hopeful that we can roll out the vaccine as quickly as possible to every person eligible in Lake County. And we have a coordinated effort with a fabulous team led by Dr. Pace, including our nurses. And we'll be submitting more information with the public campaign as it rolls out. So thank you so much for your time this morning and allowing me to be here. And thank you, Dr. Pace.
Great. Well, thank you, Dr. Sharon. Very good. And yeah, so I mean, we think the vaccine is coming in this week. We're hoping it comes Wednesday or Thursday. We have agreements with the hospitals, and we're going to try to get that out as soon as we can. The hospital workers are the first ones to get access to it, then the EMS folks, and then the nursing homes. So we'll just kind of work through these tiers. We are ordering them weekly, so the Moderna is coming in next week, and we're going to try to get more Pfizer. So, you know, this is just going to keep rolling in, and we're going to keep working with it. There's a lot of nuts and bolts to it, but we got a lot of smart people working on it. So, and we're lucky that the local healthcare partners are so on top of things with us. So, you know, I think basically just in closing, we're in this very challenging time. I think the next couple months are going to be something like we're not used to seeing, and I'm not seeing in my 60 plus years. So, you know, it's very worrisome. And I think the more people can stay home and stay out of public and stay away from things and think about a Christmas with just your household, that's really going to be a lot better. We're going to see a lot less suffering the more people that can do that. If you can't do that, then we'll deal the best we can with what comes. But that's really what we're planning for, kind of major disruption of the hospitals and of life here. So the more people can just stay home and lay low and then get vaccinated as soon as they're able, it'll be better. There is light at the end of the tunnel with this vaccine. And so, you know, I think this winter is going to be tough, but next year, starting with spring, late spring, summer, we'll start getting back to some normality. And so I think that's it for now. Thanks.
Thank you, Dr. Pace. Thank you, Dr. Sharon. Okay, let's go ahead and we'll bring it back to the board. We'll go ahead and start with, I see we have two hands. I'm going to go with Supervisor Crandall, and then go ahead, Supervisor Crandall.
Yes, I had a question about the vaccine. Is it similar to, like, you know, and I don't mean similar to the influenza vaccine, but the type of vaccine it is. So for example, you could actually catch it again in the later future at another time if you don't keep getting it every year? Or is it more like, for example, like a smallpox vaccine where it just takes it out completely and you can't catch it ever? I just wanted to ask that.
The answer to your question is that we actually don't completely know yet because COVID is so new. So that is actually something that is going to be continually looked at. But what I will tell you is that there is no doubt that getting the vaccine is more protective than getting COVID. So if somebody gets COVID, they are more likely to get COVID again than somebody who has never had COVID and got the vaccine.
Got it.
So that is a really important distinction, in my opinion. Does that make sense?
Yes, thank you for that. And I was also wondering, what is the likelihood of other folks from different counties that are getting sick coming to our county as our sick folks have went to other counties during the situation right now?
So you mean in terms of hospital transfers?
Yes, sir.
Well, both of our hospitals are called critical access hospitals, so they're considered kind of like the entry point in. So it's very unusual for the transfers to go the other way. I know there was a lot of activity on social media over the weekend about a situation, but that was not COVID related, and that wasn't really what we're talking about here. So, you know, it's certainly not impossible as things fill up around the county, around the state, if we have some beds that they might come in. They often ask, do we have available beds? And we rarely do. So, or we only have one or two and we need to keep those. So I don't expect to see a huge influx of people coming in or filling up the beds here. I was surprised to see that Adventist was using the Mendocino Hospital as a transfer site, because you know, that's not a whole lot of capacity over there either. But that just shows how that they really felt the need to get people that level of care. So I think the short answer is probably not very likely that we're going to see much of that. Maybe a little bit, but not much.
Thank you, Dr. Pace. That was my intent, just to kind of clear that up, or to just, you know, give it an explanation of how things work in that capacity. So thank you. That's all I have.
Thank you, Supervisor Sabatier.
Thank you for the update, Dr. Pace and Dr. Sharon. I appreciate the question from Supervisor Crandall. I had the same question. I thought I knew the answer, and the answer is what I expected it to be. We just don't know. We don't have all the information, just like we've been learning as we move forward about COVID-19 and how to deal with it, or what its symptoms are, or who is being most impacted by it. We're going to learn the same about the vaccination as we move forward. I did want to add something that Dr. Sharon didn't say, and please correct me if I'm wrong, but listening in to Governor Newsom's press conferences and also being on the phone with the state every week, the state itself has a vaccination task force that also reviewed all of this data. So not only did it go through the FDA process and also internal Pfizer process and Moderna process, but it also went through a team of talented individuals who know their stuff when it comes to viruses and vaccinations, who also made sure that it would be safe to bring it into California. Seeing that we have 40 million people, I think that it was the right thing to do, and I believe it's what we do all the time anyways. It's not just specifically for COVID-19 vaccination. I think this is a typical verification process that the state does with any incoming new vaccinations, and so we also have that level of data to state that it is safe to utilize. So I just wanted to add that make sure that people are aware, and as some people have seen, I'm sure everyone has seen that there are people that it's not going to be appropriate for. I think there was some people in England where, because of high allergies, they had a reaction to it. So nothing is 100%, but the fact is it's a very, very high percentage, and it does help. So let's make sure we understand that it is a very positive thing. 975 vaccinations. I'm glad to hear that it's not split in two. I had intended, my belief was that it would be split in two, but that it's 975 and it includes the booster, so that's good to hear. You talked about the tiers of healthcare workers, EMS, and then you said skilled nurse facilities. And that's where we've been seeing our greatest impact as far as the virus really harming our community. That's where we've seen our most deaths. Will 975 vaccinations allow us does that provide us the right number to be able to at least get an impact of vaccination in our skilled nurse facilities, or how tight is that? Is that gonna, what's the possibility that we can make sure that 975 can help cover some of those facilities? Because I'm sure that not every individual in those facilities have been a positive case of COVID-19, therefore still have the potential to be in case it comes back in those facilities. And we know from experience, because it's a congregate living, they're very medically fragile, that it's just not a good situation. So what's the possibility that 975 vaccines will have a positive impact for skilled nurse facilities?
Well, so I think the bottom line is the supply and the demand are not going to match up all that well. And we're going to have more demand than we have supply is the concern. And the way we're going to do it is we're going to walk through the tiers. We're going to address the local hospitals first and try to get everybody that wants to get vaccinated there, and that could be in there because it's so important to keep the hospitals up and running and staffed. And then the same with the EMS folks. With the nursing homes, they all have partnerships with pharmacies, and so it wasn't exactly clear when those shipments were going to start coming through the pharmacies, but now it looks like they're going to be arriving in the week between Christmas and New Year's. And so if we have enough after we do the hospitals and the EMS guys, we'll start with the nursing homes. But we also know that before the end of the year, the pharmacy chains are going to be bringing in vaccine and are going to be actually going out to the nursing homes and administering it to the staff and the residents. So, presumably by the first or the second week of January, we're going to have most of the folks in the hospitals, most of the EMS folks, and then the nursing homes at least have had the first round. of the vaccine.
Okay, I appreciate that answer. And also this morning on my way to work here, Moderna was approved, at least for their first approval process. I believe they have to go through a second and final approval process later this week. Do we have a number of what kind of vaccinations we might be receiving through that vaccination?
Do you want to answer that, Molly?
My understanding is that our first shipment pending approval is going to be for 100 vaccines from Moderna. They come in packs of 100.
And what happens is the state has these, since again, the supply and the demand don't match, they're having they get a certain amount coming in, and then they just have this sort of calculation on which counties get how many based on the number of healthcare workers, et cetera. And we're going to keep ordering every week based on whatever our allotment is, and we'll get it as soon as we can. The other thing with the Moderna is that one's a lot easier to work with. There's smaller shipments, and it doesn't have the same super cold requirement. Right. One thing important just to say this publicly is if you get the Pfizer, you need to get the Pfizer as your second dose. You can't switch them. And if you get the Moderna, you should get the Moderna as your second dose. So whoever's out there listening, if they go ahead and start and the first vaccine, we don't think there's a significant difference between the two. So it's, I think it's, just important for people to know that whatever one you can get, go for it, but then you have to get the same one a second time.
Okay. Thank you.
Okay. Thank you for that clarification too, Dr. Pace, because I know there are a lot of questions coming up, but I really appreciate that clarification of if you start with one vaccine, your second follow-up is going to be with the same vaccine. So appreciate that. I appreciate all the information given today. Really just want to follow along with your message of do what you can over the next couple of months here, being as safe as possible. We've done a great job in Lake County, all of our businesses, folks just doing what they need to do, and we just need to continue that until some more widespread vaccine can happen. So it is going to be critical. Appreciate all the hard work in your department, Dr. Sharon, all the health department workers, even our one that retired today, and all the work that's been done. And it's crunch time right now. And please just do what you can to protect yourself and your families. We just need to continue that while we work through this process in this pandemic. Supervisor Scott, I don't know if you had any comment. Go ahead.
I don't have really any questions for Dr. Pace and his team. I just would like to thank him for all this hard work and all that overtime. And just to make the public aware, you're talking about ICU beds and for COVID patients. And, these ICU beds are for anybody going in for any medical condition. So when they're full, they're full. And I believe that's when we saw the death rate go up in New York City, is when they weren't able to provide the care that they needed because they were overwhelmed with patients. And I know it's been said, well, they can just add more beds. And like you pointed out, they can add more beds, but then you don't have the staff to staff them. So like Supervisor Simon said, this is the time to make sure that you're doing everything right, not just to protect yourself, but to protect the community. We really need to be making every effort we can because we're seeing we do not have the beds in California. And I'm just worried it's going to get to a point where we need to send somebody out of county and we're not going to be able to find a bed for them. And I would just hate to see our residents suffer because we weren't doing everything we can to protect our community. So just thank you, Dr. Pace and your team.
Okay, if there are no more questions or comments from the board, Supervisor Crandall?
Yes, I did. Just speaking of extra beds or different beds, in regard to the sleep train center, Dr. Pace, was that 10 for just Lake County for beds, or is that statewide?
No, this is part of the state's surge planning. So they've got a few things down in Southern California, but the resources that they are putting in place to help us. So it's for basically anybody who needs it. So the sleep train is kind of in the middle of the state. And so certainly those folks will be coming up from the Central Valley or whatever. And then the 80 ICU beds that they're supposedly going to get, they've been talking about this for a little while, but apparently they're not up and running yet are there's none that are reserved for Lake County. So it's whoever, first come, first served.
Thank you.
Okay. Any more questions from the board, comments? All right, we're going to go ahead and open it up for public comment. Jake, let's start with the virtual room. Let's go ahead and open it up for public comment.
All right, I've sent a mute request out to the Zoom floor. If you would like to make a comment, please unmute and state your first and last name.
I do not see any hands up, Jake. If you see something I don't, go ahead and.
Nope, it doesn't. I'm not seeing anything, and I don't have anybody that brought up any interest to speak to me
Okay.
through chat or anything.
Okay, Jake, let's go ahead, and then if that's the case, we'll go ahead and close the virtual room for public comment, and we'll bring it back to the board, to board chambers. Do we have anyone in chambers who'd like to make comment?
Yes, we do. We have somebody. Come on up, Joan.
Joan Moss. I want to commend Dr. Tate and his staff, and I want to verify again the COVID hotline phone number, make sure I have it correct, 263-4187?
Let me check.
Is that it?
I'm going to check here real quick.
COVID-19 hotline.
And just to correct you, it's Dr.
Thank
Pace,
you.
not Dr.
Because
Tate.
there were people on the radio station, programmers who did not know that number, and people would call in. And I know that Dr. Tate speaks with one of our presidents at the radio station quite regularly. What I appreciate is the two-way communication that Dr. Tate has instituted. I've had both complaints and comments, and the telephone receptionists are very understanding, very easy to talk to, and I get immediate 24-hour responses. I do have a question. In the New York Times stories and the articles I read, there is public mistrust of the vaccines because of former histories of the vaccines, and nobody goes into what those histories are. And I think that it's important to know if that question might be answered. So I think we all need to do the best we can and share as much as possible. Thank you very, very much.
Thank you, Joan. And just for clarification, it's Dr. Pace, Joan. I know that's what you meant, but do we have any other public comment?
No other public comment in the room.
Okay, excellent. We'll go ahead and close public comment, bring it back to the board. Dr. Pace, Dr. Sharon, thank you for joining us today. Obviously, like we said already, it's a very critical time in the battle against COVID-19. Please, in our community, do what you can. But I know that our community members are doing what they can at this point. And I know that our public health office and Dr. Pace and everyone are working diligently to look at the future here and how we make it through this pandemic. So thank you very much for today. And we'll go ahead and close this item.
Thank you.
Thank you.